Wisdom teeth removal is our most common procedure. We tend to do it on a daily basis, multiple times a day. We do this under general anesthesia.
The reason to take out the wisdom teeth is there's not enough room in the mouth for all of the teeth to make it in the arch. Unfortunately, there's enough room for them to get partially exposed in the mouth. And when they get partially into the mouth, that access lets food, debris, things like that to get down around it. And that's when people can develop pain, infection, always, of course, at the most inopportune time.
The process is very easy. The surgery's done here in the office. We remove wisdom teeth every day. Most of the time it's done while you're sleeping, and the surgery you'll think takes about 8 or 10 seconds, but in truth it takes 20 to 25 minutes perhaps to remove all 4 wisdom teeth.
There may be situations when you have a younger patient that could benefit from allowing those teeth to develop a little bit more. They may get closer to the surface and be easier to remove with less trauma to them. It may be that even in a very young patient, they have so much severe crowding that they may have to have teeth removed just to allow other permanent teeth to come in and be in a functional position.
Reasons to have wisdom teeth out are for hygiene reasons. If sometimes the teeth are erupted partly in or fully into the oral cavity, it is difficult to get floss and a toothbrush back that far and get good cleaning.
Bacteria that are found in our mouth travel underneath the gums and essentially get stuck between the second molar and the wisdom tooth. Chronically, that's going to lead to inflammation, which causes pain and swelling. It also makes you at a much higher risk of developing cavities.
The problems that can arise associated with impacted wisdom teeth are really varied. They can be as simple as just minor pain and swelling of the tissue around the teeth. They can be as severe as neck infections that threaten a person's airway, and in some cases even cysts and tumors that form around the teeth in the jawbone.
When you are an adult and you have a wisdom tooth problem, we treat it the same way we do as when you're a teenager. You come in for a consultation, we'll look at the specific indications for the extraction, and there have to be even more defined indications for extraction as an adult. Some people beat the odds on a few teeth. A lot of times when teenagers come in for their wisdom teeth, they're all taken out because you don't know how it's going to progress in the future, and it's a one-time you're done. As an adult, sometimes it's only one wisdom tooth that needs to be extracted. So we don't have a one formula fits all. If it's one wisdom tooth that's causing pathology, as an adult, we'll take out the one wisdom tooth.
After wisdom teeth removal, there is a recovery. Everyone has a recovery. The normal person will be sore for a good 3 or 4 days, but sometimes it's shorter, sometimes it's longer, and it depends on each individual.